Ready? Good evening, everyone. And before we commence this evening's program, Gender Violence and Men's Health, Coping with COVID-19, I now invite you to assume a prayer posture as we invite Pastor Frederick Alfred to begin this evening's proceedings with prayer.
Shall we bow as we pray, everybody? Loving God and our Father, great God of heaven, a God of absolute perfection and pure wisdom, we thank you this evening for the opportunity to bow before your throne. We thank you, God, that you have given us this great moment where, God, we can deliberate, we can draw from you wisdom and understanding and knowledge. Lord, we know when we are going through difficult times and stormy times, you are the God of peace. When we're going through difficult times, you have all the answers to life perplexing issues. So we pray, oh God, that you will come this evening, and Lord, you will grant us, as we draw from your strength and courage, as we draw from your wisdom and knowledge, understanding, that Lord, this evening proceeding will be done to your name's honor and glory. We thank you for what you have granted us thus far, as we have been through this health week. We thank you for the partnership of PAHO and SLC Health Department. We pray that you will continue to grant us your divine peace and your wisdom and knowledge as we partner together this evening. May your spirit grant us, Lord, divine peace, divine vision and insight. And in the end of God, all praise and glory will be yours. This be our prayer in Jesus' holy name. Amen.
Amen. Thank you very much, Pastor Alfred. Now, the Pan American Health Organization is pleased to be affiliated with this evening's program. In fact, we have been a strong partner with the Ministry of Health, and we consider this forging of relationship between health and the South Liberty Conference of Seventh-day Adventists to be a very vital aspect in order to achieve health for the nation of Antigua and Barbuda. Emerging data shows that since the outbreak of COVID-19, violence against women and girls, and particularly domestic violence, has intensified and is expected to increase. The vast majority of this violence is perpetrated by men, specifically against women and girls. While most men may never use or condone the use of violence, the simple fact is that men are overwhelmingly the perpetrators of gender-based violence. Men's experience of violence is influenced by psychological, emotional, and behavioral factors, relationships with family, peers, social norms. In collaboration with professionals from other sectors, health professionals can help prevent or intervene in males' perpetration of violence against the lifespan through identification of factors that place men at risk and referral of male patients to evidence-based prevention and intervention resources. Gender equality cannot be achieved without the involvement of men and boys. Change is slowly taking place, and men are increasingly working alongside women to support gender equality and the empowerment of women and girls. It's in this context that the Ministry of Health in Antigua and Barbuda, in coordination with the South Liberty Conference of Seventh-day Adventists, has organized this panel discussion targeting men. This evening, we hope to achieve three objectives. One, examine factors that influence gender-based violence and the effect on men's health. Two, to present the current situation on gender-based violence in Antigua and Barbuda. And three, to share the current services available to address gender-based violence and men's health in Antigua and Barbuda. Before I invite Pastor Green to give his welcome, permit me to introduce him to our participants, the people of Antigua and Barbuda and Montserrat and St. Kitts Nevis. Dr. Carson L. Green is a native of Antigua and currently serves as the president of Religious Liberty Director and prayer coordinator of the South Liberty Conference of Seventh-day Adventists in the Caribbean Union. He previously served as executive secretary treasurer and then executive secretary. He has served as a minister of the gospel for the last 28 years. He has a background in finance and accounting and worked as a banker before responding to the call to prepare for the gospel ministry at the then Caribbean Union College in Trinidad, where he graduated with an associate degree in natural science, mathematics, and a Bachelor of Arts in theology with minor in biblical languages. In fact, he graduated magna cum laude in 1992. In 1997, he graduated from Andrews University with a Master's of Arts in Religion, with emphasis in biblical studies. In 2013, he graduated from the same university with a Doctor of Ministry. He has spent much of his ministry in the area of leadership and coaching and is a certified Myers-Briggs temperament inventory practitioner. He is also a family life educator and co-hosts the weekly radio program, Marriage Encounter, and that can be heard on Second Advent Radio. Dr. Green is married to the adorable Michelle Warwick Green of Guyana and has two young adult sons. He sees himself as a change agent and is guided by the principles of honesty, excellence, integrity, and service. I now invite Pastor Dr. Carson Green, President of the Salt Lake Conference of Seventh Adventists, to give us welcome remarks and opening remarks. Thank you.
A very pleasant good evening to all of our viewers. It is my delight tonight to share with us just some words of welcome. The South Leeward Conference is pleased to partner with PAHO, the Pan American Health Organization, in bringing you this seminar on men's health, gender-based violence, and COVID-19. We are delighted to be able to partner with Pan American Health Organization. It is one of our strategic initiatives to form alliances with other agencies to effectively communicate the message that God desires us to be healthy, strong individuals. Again, the South Leeward Conference, Seventh-day Adventist organization, is carrying on the work of the church. We believe not just in proclaiming the gospel. A lot of people, when they think of church, they think of hearing a sermon, etc. The Seventh Adventist Church believes that Jesus Christ wants us to develop holistically, physically, mentally, socially, spiritually, emotionally. And so our focus on health is because we understand that God made us. He's our creator, and he wants us to enjoy good health. This evening, the health department is pleased to come your way to share, and we trust that all of our viewers, those who are participating in this program tonight, and so many others who are watching via our YouTube platform on SLC Adventist, we trust that the information presented will prove meaningful. I'm so very grateful that our health director undertook this initiative, Dr. Yulali Semper. I want to acknowledge the contribution that she has made to the organization and implementation of this program. Delighted, Dr. Semper, and trust that the rest of the week's program will prove meaningful. I want to welcome all of you who are here with us and those who are viewing in wherever you are. And our host tonight said that we are catering for people in Antigua, Barbuda, St. Kitts, Nevis, and Montserrat. That's a South Leeward Conference territory. But be assured that we have viewers from all around the world. I glanced at the YouTube chat just now, and I did see someone from Puerto Rico. We have viewers in France, in North America, in Europe. So we are reaching not just the South Leeward Conference territory, we are reaching around the world. And we proudly do so because we believe that health is an important area. If you're living and you're not enjoying optimum health, well, we trust that you will heed the admonition shared this evening, and especially to our men who are listening on the platform tonight, men who so often fear going to the doctor and giving attention to their health. I want to appeal to all of our men to stay tuned and please, by the grace of God, implement the principles. Last night, or yesterday afternoon rather, we had a tremendous session with the folks from PAHO, and I'm sure that tonight it's going to be an amazing session likewise. So welcome to all, and we trust that the program will indeed prove meaningful. God bless all of you.
Thank you very much, Dr. Green, and that sets the pace for our evening's activity. For this program, we're going to have some very interesting presentations. We will also have an inspector of police to speak to us. His name is it's a female, Miss Claudine Morgan. Is Miss Claudine Morgan with us? Miss Morgan, are you there? Okay, she's not there as yet. We will be having Mrs. Alexandrina Wong from Women Against Rape. Mrs. Wong, are you there? Mrs. Wong? She was there earlier. Mrs. Wong, I see your name. Please unmute your mic and just indicate that you're present still with us. Okay, and we should have Miss, this name is difficult to pronounce, but I'm gonna use her nickname for now. Her name is actually Miss Labrachetta Nana Oye Hesi Bain. I hope I pronounced it correctly. If you're there, please say hi.
Hello, it's Labrechta.
Labrechta, sorry for the...
Call me Lebi or Nana.
Right, so thank you very much for the correction. Okay, and Mrs. Hesse Bain will be fielding your questions and answering them as we go along. And we will round up this evening's program with expression of thanks from Dr. Eulalie Semple. So to continue, we will now have Darlene Omier. Darlene Omier is a Nicaraguan medical officer holding a Master of Science degree in maternal and child health from the University College of London. She has over 20 years of professional experience working with programs aimed at reducing maternal and neonatal mortality and morbidity while ensuring women's and girls' reproductive rights. As a program manager, she worked with the international government, private sector, and UN. Her responsibilities included human and financial resources management and program monitoring and evaluation. She has strong capacities in policy dialogue, networking, maintaining, harmonizing government relationships, and establishing alliances. She has been working with United Nations Family Planning affiliation for the past 10 years, coordinating the SRH component, successfully leading a team of experts in HIV, reproductive health commodity security, family planning, sexuality education, and AYSRH. I think she will tell us what those abbreviations mean. Ensuring RBM and integration with gender and population issues. She worked with UNFPA in Lesotho as a maternal and HIV specialist. She is fluent in Spanish and English and speaks French at the B2 level. She is known for her high level of interpersonal skills and naturally engaging personality, teamwork, dependable and fast learner, adapting to multiple environments in order to achieve the expected results. Darlene Omier is the advisor for family and community health at PAHO WHO office for Barbados and the Eastern Caribbean countries. I now invite Dr. Omier to do her presentation on COVID-19 and men's health. Dr. Omier, please unmute your mic.
Yes. It's a pleasure for me to be here and to share some of the discussion points that we're going to see regarding men's health and gender-based violence and COVID-19. I understand this is the second day of a full week activities that are going to be held in the framework of men's health. And I do congratulate the organizers on this activity. I think men's health is a topic very not as often discussed, however, very relevant in society, particularly now that we're living these challenging times. So I'll start my presentation with this first slide in which
Please share your slides.
You're not seeing it?
No, we're not seeing the slides.
I'm sorry. So now, I thought you were. Now you're gonna put me in problem.
If you want, I can share for you.
Yes, please.
Okay. Are you seeing the slides now? Is everyone seeing the slides?
Um,
Yes, we are.
Okay, wonderful.
Yes.
so can you put the next slide, please? So yes, so the way I'm going to structure these presentations, I'm going to talk a bit about men's health, then I'll link men's health with domestic violence, and then I'll talk a bit about the violence cycle, and I'll go quickly into COVID-19, and then finish by giving some suggestions as to what could be done to address this situation. So the next slide, please. So Dr. Carissa Etienne is the PAHO's director, and I'm quoting her in this, she's saying, compared with women, men have a mortality rate 4 times greater due to external causes and 7 times greater risk of dying from homicide. So this statistic is really, really alarming because we're saying 4 times greater due to external causes, their mortality, and they have 7 times greater risk of dying from homicide. Now, the next slide, please. Why does this happen? So this definitely will result in important issues, and men are dying from issues related to diabetes, cancer, hypertension, stroke, depression, obesity, stress. And these factors have a lot to do with men's behavior, because these are resulting of their behavior. And if you look at the next slide, I'm highlighting some of the behaviors. Next slide, please. And we're seeing men tend to use, we have statistics showing that alcohol consumption is started earlier in men than in women. In other words, men start consuming alcohol at an earlier age than women. And we all know the effects of alcohol on your brain, on your body. And of course, the younger you start using alcohol, the more you are risking your health. We also know that men tend to be more risk-taking. Men tend to deal less with stress. The suicide rates are higher in men as well. And therefore men have less coping abilities to deal with stress. And men also have less practice to seek health care. And I wouldn't go into details into this because I'm sure you discussed this yesterday, but we are all aware that men tend to seek health care much, much less than women. And not necessarily because they don't get sick as often as women, but because seeking health care is often seen as a weakness, or often seen as seeking help. And because of our society, men are supposed to be strong, provider, and in some Latin countries, machos. So seeking help would not necessarily fit the profile that society has imposed on men. And I say society has imposed on men because it's not necessarily true that men do not feel sorrow, that men do not feel pain, that men do not feel anxieties, but it's just that society has placed this strong and important weight on men that they're supposed to be brave. They're not supposed to cry. Men are not supposed to show any signs of weakness, because that has a whole implication on your manhood and the way you're seen in the community. And that definitely has a strong influence on why men are not seeking health care. So this behavior component of them being risk-taking, in them being consuming alcohol and other sorts of drugs and things, are strongly related to gender-based violence, and in this case, domestic violence. And I'm going to be using gender-based violence, domestic violence, intimate partner violence, but they're not necessarily the same, but for this purpose, we're going to use domestic violence as that. Are we seeing the slides right now?
Yes, is everyone seeing the slides?
Sorry?
Is everyone seeing the slides? I have the slides, I'm seeing them. Any problems with the slides?
No, so far.
Okay, thank you.
It's just
Continue,
that
Dr.
I'm
Wong.
just not seeing the one you're currently showing, but I guess that's just my screen. So coming back to what I was saying, gender-based violence then, and I'm not sure why I'm not seeing it, Reynold, but then.
No, either. I'm on slide 6.
Okay. I'll just pull it up myself now too, so I can see it. And just give me.
The screen is not showing slide 6.
It's not showing slide 6?
No.
Okay, I'm going to close again and try to start over. Close and start over. Hello, can you hear me?
Yes, we're hearing you. So as I was saying, this behavior tends to link a lot to gender-based violence. And as we're going to hear from the next panelists about the situation of gender-based violence in Antigua and Barbuda, and you'll see that many of the cases are highly linked with the use of alcohol, the use of drugs, and since we're saying men do not have this health-seeking behavior, if men are feeling anxiety or depression, it's very unlikely that they would seek help from the health services. Hence, they're finding the way to deal with it with violence. And I'm not justifying men's behavior, but I'm just giving an explanation as to why many cases men are the main perpetrator in case of gender-based violence. Now, bear in mind that we're not saying that that men cannot be victim of gender-based violence or domestic violence, but unfortunately, the vast majority are women. And most of our victims are women and girls and children, and most of the perpetrators are indeed men. So when we look at the concept of domestic violence, we say it's any act of violence that results in or is likely to result in physical, sexual, or psychological harm or suffering for women. This includes threats, coercion, arbitrary deprivations of liberty, and it could happen either in public or in private. And this is important because before we believed that domestic violence could only happen within the house. But this concept now is saying, sorry?
Yes, go ahead. Do you have this?
The concept now is saying that domestic violence does not necessarily has to do where it happens. And that's why we're moving from the term domestic violence to intimate partner violence, saying that is between, and I'm going to pull on this second slide to say that this violence is threatened or physical or sexual violence or emotional abuse directed toward a spouse, an ex-spouse, a current or former boyfriend or girlfriend, current or former dating partner. And it could definitely happen inside or outside the home. Now, our statistics is saying that 1 in every 3 women have experienced some form of violence in their lifetime. 1 in every 3, meaning that I can't see the exact number of how many of us are connected tonight, but we definitely have more than 3 women connected tonight. That means that 1 in every 3 of us here tonight at some time in our life had experienced some type of violence. Now, victims can be male or female, as I said earlier. They could be dating, cohabiting, or married, and it can occur, and I repeat, the stress outside or inside the home. Victims can be of any age, sex, race, culture, religion, gender, education, employment, marital status. That does not, and studies have shown that over and over again. It has nothing to do with your education. It has nothing to do with your race and your sex. In all the cultures, we have violence, some more than some. Some poor people experience violence, rich people experience violence, rich women with low education level, with high education level, because the factor associated with violence does not necessarily have to do with that, but it has to do with a power relationship. And when I'm saying violence, I'm not talking about a single fight or disagreement in a relationship. It's a pattern. It's a pattern of coercive behavior where one partner is trying to gain power or control over the other. So this is something happening regularly, and usually it would escalate. So it might start by a pushing, it might start by offensive words, it might start by just, insulting or even, raising voice. And then eventually it could escalate to what we know. And unfortunately, we've seen cases of femicides, women dying as victims of domestic violence. And this picture, and are you showing the picture right now, Reynold?
Yes.
Okay, so this picture is a picture of the typical domestic violence that we know, or what we usually think of a man physically abusing a woman, and that's the most common form indeed. The next picture also shows the same situation in which someone has power and is imposing power over another person. But it does not necessarily have to be always like that. If we go to the other slide, and you can see in this graph, what I have here is, so what is in green are the different forms of sexual violence. The yellow is the different type of emotional violence. Then the gray is economic violence, and the blue is physical violence. Physical violence, we have pushing, punching, kicking, pulling hair, slapping, and we know cases of pinching, any form of hurting the other person. Economic, taking a woman's money, or the well known that the woman is not supposed to work, I'm supposed to be the provider, and she's supposed to stay home, and she's supposed to tend to the kids and tend to the house and have my dinner ready when I get home, and it has to be hot, and it has the right proportion of salt and sugar, etc., etc. And if that's not that way, then she's provoking me to a violent situation, and I would react to a violent situation. And unfortunately, many women actually believe this, because it happens so much time that they actually believe that they are doing something that are making them be victim of violence. So they're the ones saying, I provoked it. I didn't have his food in time. I didn't put enough salt, or I asked him something when he was busy. And the sad part about it is that they transmit that same feeling to their children, and that child would also grow in that same pattern. And the man also believes it. He believes that, the only way to get your wife doing what you need and what is supposed to be done is punishing her and forcing her. And many times the only way we know to do it is through violence. We also have insulting, shaming, intimidating, controlling. And in the sexual, we have forcing women to have sex. Many people believe that because this woman is my wife or my partner, I have a right over her. So if she doesn't want to have sex today, but I want to, she's my wife, that's not a violence because she's my wife. And that's not it, because as long as a person is saying no, you're going against the person will, independent of their marital status. Now, the numbers are saying that the variety of cases range from 13 to 61%. So that's a very, very big margin. 13 to 61% of women ever having experienced physical violence by a partner. 4 to 49 reported having severe physical violence by a partner. 59% reported sexual violence. And this is a survey that WHO did. And this was the result that came out from it. And so what we're saying, that is something very common, and it happens in all parts of the world. And as I said earlier, there's no relation with age or level of education or employment. And because of this problem with gender-based violence, is that when we were discussing the Millennium Development Goals, we actually have targets addressing violence. Target 5.2 has eliminate all forms of violence against women and girls. And we have target 5.3, what says eliminate all harmful practices, such as child, early and forced marriage. And we don't know many of these cases in the Caribbean, but we know in Africa, there's a lot of female genital mutilation as well. So we have Millennium Development Goals that are aiming towards reducing gender-based violence. Now, when we look at gender-based violence impact in society, it also has a financial impact, and is estimated that $5.1 billion is spent on attending issues related to gender-based violence, mainly related to healthcare or just judicial services and social services, which is 1.6 of, which is going to be 3.27 million in Nicaragua in 1999. We don't have much studies about this, but definitely we know that it has a strong financial implication. So why do we have violence? We were saying from the beginning that the behavior, men's behavior, and the pressure society has put on them is obliging them in somehow to react this way. And because they don't seek help in time, they don't find other ways to deal with their stress or anxiety than to be violent. But how can we better understand it? Let's start from the point that there is significant power. Someone is imposing power on someone else. So there's inequality. And we're seeing a strong inequality relation between men and women. And I must say that it has improved a lot over the years, and it would not be fair not to recognize that. I think we have come way, way compared to 50 years ago. But we still have a lot to do. I think though we've seen more men engaging, more men concerned. And the fact that you're here in this workshop tonight is because you really want to hear also how you can support reducing the number of gender-based violence cases, and how we could build or construct a more fair society, a more equitable society, a more equal society. If you look at this model here, it's the ecological model to explain or to understand violence. The next slide, please. And this model looks at various aspects, and it starts from the individual, and it looks at the individual, it looks at the family, it looks at the community, and it looks at the society. If we look at the next slide for the individual, as I said before, we as individual believe, because that's the way we were reared, that men is the imposing gender and we are women are weak, we can't make decisions, we can't put our opinion up front, and in some cases we are even not allowed to work, and just in general we're a weaker sex, and that's something we have in our mind, in our way of living, because it has been something imposed in us since we're small. And then men as an individual also believes it because that's the way they were reared.
What slide number on, Dr. Omir?
Sorry?
Am I on the right slide for you?
I am not seeing your slides. You're on the one that says individual, the ecological model.
I don't think so. Your slide have numbers?
Sorry?
Tell me the slide number, please.
Okay, so we're on slide 19.
Okay.
You're there now?
Yeah.
Correct. So I'm showing the next one, please. So this is the ecological model. If you touch again, Reynold, yes. So this is what I was saying. The individual himself believe that he is less worthy, and the other individual believe that he has more value. The second is the family. The next slide, please. And the family is the structure that, and you could click it again just so I could get the images. If you just click it. Yes, one more time. Yes. So family also plays an important role in the way our practices. If we have a family structure and we have the tendency to live usually with either a mother-in-law or grandmother or mother, and they also have these beliefs that are transmitted to you. And then in the family, we're also reinforced that we are not supposed, and I'm saying we, I mean women, we're supposed to have a specific type of behavior because we are women. We're supposed to clean, we're supposed to cook, we're supposed to take care of the kids, and the man could come home tired. Both of us went to work, but he's tired. I'm supposed to cook and serve him. And the family helps reinforce that. The next slide, please. And the community as well. If you click it 3 times, Reynold, yes, one more. Exactly. Just go back one, sorry. The community also helps reinforce that. And we can see in our society how we condemn women who have certain behaviors. Like we could easily see a man, and I'm just thinking of an example of a man drinking or a man being drunk, and that's okay, even though it doesn't meet the standards. But if it was a woman, that would be such a big disgrace, such a big shame, when both of them probably, are exposed to the same amount of alcohol. It's just that we have different standards for women and men, which not necessarily is equitable. We tend to be more harsh and more condemning to women than to men. And it's because we still have this idea that women are the frail sex and women can't do this or they're not supposed to do that, but men, it's okay that they can do it. And then in the society, the next slide, please. In society, it's the same behavior. We have laws and policies in place that reinforce this behavior. We know, sorry, you went too fast, just one behind, please. We know that we're in some communities, we have women doing the same job like men, but earning less because she's a woman. We have in some positions that you can vote, or the high position in company is usually given to a man, not to a woman. The woman could get high positions, but in the Ministry of Health or the Ministry of Education or the Ministry of Social Development, because those are the small ministries. You rarely find women in position as the Ministry of Finance, etc. And this is because this is the mentality we've been going with. The next slide, please. And I know my time is getting short, so I'm going fast. So we need to analyze what could be done, because as I said, this is something that has a great magnitude around the world. And if we don't find mechanisms to deal with it, and as I said, men have an important role with it, and their health has a lot to do. If we could early detect a man that is going through anxiety, if we could early detect a man that is going through alcoholism, or a man that has problems with drug addiction, or a man that has violence problem, if we could early detect and that man could seek help in time, we would have a different society. So we need to engage men if we want a positive response. And in this slide, I was just making, coming back to the society inequalities, we were seeing that in Barbados and Jamaica and Trinidad and Tobago, they found that 3,401 victims who had placed a case to the court, but nothing happened. The cases go when women, you know, if anybody had an opportunity to interact with someone that is victim of gender-based violence, you would understand how challenging it is to get a woman to actually take a legal process. And that's a huge step for a woman. And for her to take this step and then nothing happens, it's really, really disappointing. And unfortunately, many of the cases do not move from where, you know, from the initial stage of the legal structure. In the community, we have some, you know, the religious beliefs that, oh, if you are married, you're supposed to endure that forever and ever, amen. Even if he's been extremely violent towards you and your children and he's not seeking help and the violence is escalating, but because you made a promise to live forever in good and bad, you are supposed to stay there till death do us part. And then in police sometime also, the police, this is just a general, I'm not specifying a specific police, but in general, police tend to minimize domestic disputes. And they say, oh, they're a couple, they fight all the time, you just ignore it. And we tend to repeat that pattern all the time. And we would register it just like a domestic dispute, and this is nothing serious to worry about. And the children and the woman go back to that environment. And then again, the whole system, as you mentioned before. The next slide, please. So what I want you to reflect on this slide is men are a result of a society. Their behavior is a result of a full pattern of society. And violence is a cycle. So if you look at this slide, you can see this child, his dad is being violent towards him. And as he grows up, he becomes to be the same person that is being violent toward his son. And if you look at the top right of this slide, it's statistics from Save the Children. And they're saying that 70% of abused men were abused as children. So it's a cycle. My dad was violent to my mom, so I am going to be violent to my wife. And it's a pattern we repeat and repeat. And this cycle has been proved scientifically so many times. But I guess what I'm trying to say in this is that we need to break the cycle. We cannot continue saying that this is a cycle and it happens. Somebody has to stop it. We need to do something. We can't continue living like this. The next slide, please. And in the next slide, I'm just highlighting how childhood trauma affect health across your lifetime.
Dr. Omi,
yes?
Time is up. You'll need to accelerate or go to the section that deals with violence against men quickly.
Yes, this is my I have 2 more slides after this, sorry. So we're just saying how trauma affects your lifetime. The next slide, please. And then we need to understand how boys live and their emotion. The next slide, please. And then the trauma as it impacts boys' health and their mental, physical. So COVID-19 puts us in a situation, the next slide, please, in which we have an additional stress, the uncertainties, the losing jobs, the confinement is putting an additional stress. Though all the stress we had before, COVID-19 is adding more. And this is proving that it's increasing the cases of domestic violence. The next slide, please. So my call now is to take this as an opportunity to make a change. Man does not have to be the protector, the pro-risk, the provider, the procreator, the problem solver. Next slide, please. But rather, let's make it a change. And we help, as men, help-seeking behavior is not a weakness, but is rather a help-seeking behavior to produce a healthy manhood. Don't look at it as something, as a weakness, but rather as moving towards a change. And the next slide, please. I'm going to skip the policy approaches. And this picture, the next one, please. I'm going to skip that. And this picture I just put up because we were talking about the risk. Look at, he's taking his child, but he's talking on phone. He's holding the bicycle with one hand. The next slide, please.
And yes, Colin, he will put it in.
So we want to move from a gender exploitative situation to a gender transformative. And I'm going to finish here with the lessons learned. The next one. So we need to see men as part of the solution and not as a competition between women and men, who is the victim and who is not the victim. We are both being affected by the violent situation, and we need to stop victimizing each other and look as men as a solution. Work with men where they are and understand their social and political and cultural context. The next slide, please. The next one. So as I said, we're not competing to see who is the victim. I'm going to skip again just to reach to my last slide right now. This one. So safe behavior is the one before right now. Safe behaviors is going to ensure that we have safe relationships. If we have safe relationships, we would not have any more gender-based violence. Thank you.
Okay. Thank you very much, Dr. Omir, and I'm very sorry that we had to ask you to speed it up.
No, I understand. I had my timer.
Time is not to each presenter to complete.
Sure. I completely agree.
Men are abused by women extensively. It's just that we don't hear a lot about it. And
we don't denounce it because it's being seen as a weakness.
Yes, it's promoted as a weakness in the men.
Exactly.
I can bet you're going to have a lot of questions on that in a few minutes when we get to that section. Okay, thank you very much for your presentation. Now, we should be hearing from Miss Claudine Morgan, a police inspector. Is she online with us? Claudine, are you online with us? Please indicate. Okay, I guess Claudine is not with us this evening. It would be nice to hear what is happening in Antigua with our men, how they're being abused by women. Is Valerie there for the Ministry of Health?
Mr. Hewitt?
Yes.
Mr. Hewitt?
Yes, Valerie.
Yes, Miss Morgan is trying to speak. She's using, well, her name on the line is user.
User. Oh.
Yes, but she was, I don't know if she did not mute her mic, but she was trying to speak.
If I can. User. I'm not seeing her.
Yes, Reynold, she's there.
Yes, she's there.
Yeah, but I'm not seeing her microphone.
Yeah, I don't see one for her.
But you can control her, right?
Let me see.
Oh, but her microphone is not there.
Yes, she doesn't have a microphone.
No, she didn't install the microphone.
She's using. Claudine, can you type a message. Let us know if you have a microphone. Okay, I don't. Okay, she says hi. Claudine, do you have a microphone? Please type in the chat, yes or no. Do you have a microphone? Okay, I'm afraid we'll have to come back to you. Please, if a microphone is close by, connected to the computer, and we will come back to you in a few minutes. Okay, is Alexandrina Wong there? Mrs. Alexandrina Wong, are you there? Can you hear us? Please unmute yourself and say hi, just to make sure you can hear. You spoke to me earlier, your microphone was good. You're still, I can see your mouth moving, but I cannot hear what you're saying. So go to your name. On the participants, you will see a blue bar, mute or unmute. Okay, you're on mute, but we still cannot hear you. Connect your mic. Oh, you sent me your slides, but we can't hear you. Can you plug in your microphone? Mrs. Wong, we cannot hear you. Okay. Can you hear me? Type, okay. Well, we cannot hear you. And that is the problem. I have your presentation, but we need to hear you give the presentation. Your microphone worked earlier. There's nothing I can do from my end to assist you. And this is very unfortunate. Your microphone worked earlier. Okay, so we'll come back to Mrs. Wong in a few minutes. So we will move directly into our discussion.
I am joining from my phone.
Okay, so we are getting a feedback. That's being creative. So don't stop talking. We want to make sure we can hear you clearly. Try again, Mrs. Wong.
I can hear you.
Okay, don't put the phone too close to your mouth. Try again.
I can hear you.
Okay, keep it at that distance or a little farther, and we should not hear an echo. So you're gonna
Shut off the computer and talk to the phone.
the computer seems to have a problem.
She have on the mic on it, so it's gonna give the feedback to the phone.
Okay, all right.
Shut down the computer.
Mrs. Wong, please turn off the microphone on your computer.
My computer does not have a mic.
Yeah, but it's open. You can hear me, right? From your computer.
Okay, I have turned it down.
Good, good, good. Okay, so I'm going to put up your presentation now. And
Thank you.
Better than the last. Okay, can you see the presentation?
Yes, I can.
Okay, can the other participants see the presentation?
We're seeing it fine.
Okay, thank you. You may begin, Mrs. Wong, in a few minutes. Let me introduce you properly. So Mrs. Wong is a consultant in health and gender, having retired from the government service as a district nurse midwife in 2008. She held leadership positions both in her church and community setting and have partnered with government ministries in policy development, as well as continuing the national response to eliminate violence and its intersection with HIV and social issues. Her primary role and responsibility within the not-for-profit, non-governmental organization, that is Women Against Rape Incorporated, is management and promoting inclusive health parity through education, public awareness, and psychosocial support. Women Against Rape primary constituents are women and families affected by gender-based violence. Mrs. Wong's personal objective is to promote sustainable change at the 4 ecological levels in a strategic and sustainable manner that embraces the combined human rights and public health approach by utilizing her extensive background in gender and development, human resource development, management and healthcare services, program development and implementation. She is the matriarch of a large, loving family, most of whom are born and continue to reside in Antigua. Ladies and gentlemen, I now present you Mrs. Alexandrina Wong, President of Women Against Rape. Mrs. Wong, over to you.
Thank you very much. Good evening, Mr. Hewitt, and to members of the esteemed panel, and to all other persons who have joined us this evening. It's indeed a pleasure to be here. I will start by looking just one slide, the role of men, and this is a societal perspective, and this is for the 21st century. It still is the same. Not very much has changed, although we have had so much legal reform, so much advocacy, and so many other treaties that have been put into place. However, the societal perspective would need more than legal reform. I know there are many church persons on this call. Good night, Mr. Green. I hope you're okay. And I know that prayer changes things, but the cultural barriers that our previous speaker alluded to, we find that they are the main challenges, as it were. So I just wanted to stick that in there because my role here tonight is to speak primarily to the services that are available. But just to reinforce that men, based on societal perspective, in this 21st century, still are expected to do certain things. And that power and authority that continues to drive the conflicts continue to exist. And so we need to move away from that. So could we go to the next slide, please? Thank you. The psychosocial support that we offer, we find that it has worked quite well. Also, the public education and awareness, which comes in a lot of advocacy and partnering with governments in various communities. Our community network has grown over the years. And the trainings that we have done them with the police, we have done them at the community nursing level. Some persons from Mount St. John's have participated also in trainings that we had, because in 2017, we partnered with a fund from the Antigua and Barbuda. We looked that continue to fuel domestic violence. And our findings were similar to what the previous speaker said. It is still 1 in 3. And one of the main challenges is poverty. And so we have to look at the alleviation of poverty, because with poverty comes an economic dependence. And so that further strengthens the man's role as provider, gives him further power and control over his partner, hers in that relationship. And if Ms. Morgan does get on, she will be able to address this. The report is made, and the partner, the woman, says to the officer, "Officer, I would just like you to warn him." And so the question arises, why do women remain in abusive relationships? The whole issue of entrapment, and one of the factors contributing to that entrapment is the financial or economic dependence. Because were that man, the perpetrator, the accused, to be locked up and or incarcerated, where would the income come from to support that woman and possibly her children? Unfortunately, our support system in Antigua and Barbuda is not that robust to support that woman and her family, neither with finances or with shelter. Because one of the main gaps that we have is that we do not have a dedicated shelter. My police colleagues are faced with the challenge when a woman and her children turn up at the station. They cannot send them back to the home because of a threat to life or property. So where would they send them? We have no shelter. So services by the police, there are some challenges. The community clinics, the sensitization was done there. We have used fact sheets from the World Health Organization specifically designed for community health workers. And so they have an idea of what they should be looking for. However, the practice has not been standardized, and we need surveillance. Mount St. John's Medical Center is another place where services can be accessed. Also, the Directorate of Gender Affairs, we offer psychosocial and other support. The services that we may not have at the time, we can refer to our other partners. And then there are also private providers. Next slide, please. So these are some contact details that we can share with you. Feel free to contact us at any of those. And I know that that is the hotline number for the Directorate of Gender Affairs. And just before I say thank you, my slide with the next steps got lost somewhere along the line. So the next steps would be strengthening social partnerships, strengthening community services, looking at our laws and also seeking to work together stronger with a common goal. And if we were to do that, I am quite sure that our men, they will start thinking differently, if not now, sometime in the near future. Thank you very much.
Okay, thank you very much, Mrs. Wong, for your enlightening presentation. I still have plenty of questions. Where do men go when they're abused? What are the services being offered for men who are abused? I need to hear that. What is there in Antigua for men? Our men.
I specifically, I gave you the areas where they can go. I said gender affairs.
Okay,
we have private providers in psychologists, and we have women against rape. Those are spaces that I know about that have served men in the past and continue to serve men.
All right, stand by. Lots of questions. Men need help. So we're coming back at you in the question and answer section.
Thank you.
Is Inspector Morgan there with us? We need to move along quickly. I'm going to ask her if she's there to make her presentation short. Inspector Morgan. Inspector Morgan, are you there? Oh, yes. Okay, your mic is open. Yes, your mic is open. We cannot hear you. I can barely hear you. Try again. Not hearing you at all. Your voice is very faint. Very faint. Yes.
She did not dial in with a mic, that's why you're not hearing her. She needs to go back out and come back in and dial in with the mic.
So sign back, sign out, and sign in, and choose the computer mic. Okay. So when you come back, we will take your presentation. Yeah. Now, so maybe we can take a few questions until Inspector Morgan is back. All mics are open now. Please indicate if you have a question or comment. Mrs. Hesse Bain, please stand by. Okay, so I think we will take the open dialogue now. So to manage this section on the open dialogue is, I'm gonna just go straight to the last name, Mrs. Hesse Bain. She is the founder and executive director of Shida Sustainable Development Solutions. She is known by her middle name, Nana or Libby, nickname for her first name. Nana is a social economist and gender expert with 24 years international experience. She has worked with governments, international organizations, development banks, and NGOs in the Caribbean, Africa, United Kingdom, and the Americas. Nana holds a Master's of Economic and Social Studies degree in Development Management, specialized in poverty reduction and sustainable livelihoods from the University of Wales, UK, and two Bachelor of Arts degree in Economics and French, with a minor in pre-law from the Indian University of Pennsylvania, USA. Working on socio-economic, and gender justice issues for Nana is more than just a career. To her, it is a unique privilege to affect lives and advocate on behalf of persons who want to advance change in their countries, communities, and institutions. Nana is a citizen of Ghana and Antigua and Barbuda. She currently resides in Trinidad and Tobago with her family. I now invite Mrs. Hessie Bain to say a few words, and then we can take questions and her responses. Over to you, Mrs. Bain, Hessie Bain.
Thank you so much, Mr. Hewitt, for the introduction. And I also want to thank the presenters for a very informative session that they have given us as background for our discussion. I must say that I am not here to answer questions, but rather to moderate the question and answer session. This means that all our viewers and all our participants, I hope there's someone who is actually also monitoring your YouTube and I think Facebook as well that you're on, so long as, and I would also look at the chat. But this is the opportunity for us to now pose questions based on what we have heard. We heard the representative from PAHO share with us some of the issues that affect men and why they behave the way they do as perpetrators. I know her as Nurse Wong. So Nurse Wong also mentioned a few issues in terms of their experience as a service provider as well, including the services that are available in Antigua and Barbuda. I would like now to ask our viewers and our listeners to pose their questions. You can either raise your hand using the raise of hand feature if you're on Zoom, or you can type your questions if you're on YouTube. And I'm sure somebody from the coordinating team will feed us those questions, and we can ask our presenters to help us with their responses. If there anything that that others would also like to ask, because I believe we have the pastor from the South Leeward Conference online. We have the PAHO representative, and we also have the service provider representative, which is Nurse Wong.
Yes,
So listeners, this is your time. Any questions or any comments from our audience?
Mrs. Bain, I noticed that Inspector Morgan is back with us. Inspector.
Okay, so you want to take her brief presentation?
To be very brief.
Sure.
Mrs. Morgan. We cannot hear you still. We still cannot hear you. Okay, let's take a few questions. Okay, in the chat, there are two questions here. What type of violent behaviors do men experience and how can they cope? And why are men afraid to report violence?
Okay. I know statistically what the data tells us is that the number one violence that men face from women is verbal abuse. This is something that has been documented and has been shared with in various publications. It would have been interesting to hear from the inspector and also from Nurse Wong, who are service providers, in terms of what are some of the cases and issues that men bring forward when they come to them for services. So I will lay the groundwork for that in terms of men experience verbal abuse as their number one form of abuse from women. However, I would also like to hear from our presenters, especially when it relates to Antigua and Barbuda, and I guess our PAHO representative can speak on behalf of the OECS, who are also part of this call, their experience of men and violence that they face.
If you don't mind,
Yes, Nurse Wong, please go ahead.
Hello?
Yes, go ahead, Nurse Wong.
Okay, thank you. I do agree with Nana with the verbal abuse. What I have found, what we have found also is a case where women tend to hold men to ransom. What do I mean by that? They use the children as pawns. They especially if there has not been a legal regulation put in place regarding custody and visitation. And even in some cases when regulations are put in place, they say to the guy, well, okay, you can come on Friday and collect them. And when he turns up on Friday, or they went by their grandmother, or no water is coming, so you can't get them today, you have to come back Sunday, that kind of thing. So that is very daunting, especially when the guy has been looking forward all week, you know, to spend time with his children, which is his right. We have situations also where a guy may have children outside of his regular or committed relationship. One case in point, these two persons have been living together for a number of years. They're engaged to be married. They have a child. And he got somebody else outside of that relationship pregnant. And she didn't get one, she got twins. And so she, that female, well, she gave him and his fiancée a run for their money. And believe you me, I could recall that during COVID, and that's a major challenge, you know, our allow me to vent a little here. The emergency team that was put in place, there was nobody on that emergency team to address gender-based violence. Nobody on that emergency team. And so what happened when we went into lockdown, a consideration wasn't given for a number of things. And so no allowance was made for persons who had to go and pay their child maintenance. And this guy called me. He called me, he said, Miss Wong, I need to find some because I don't want this lady to be calling my home. And so I'm speaking from 2 points here. That is one kind of harassment that men may experience from a woman who has children or a child for them. And the other one is that our government needs to understand the psychological impact that men experience, especially when they have such types of partners who literally like breathe down their necks. And so that kind of psychological violence we have seen. I don't know if anybody else has seen anything else to add. Thank you.
Okay.
Thank you, Nurse Wong. There's another question regarding what types of violence do men experience. I think we have answered that. How do they cope? In terms of coping, I will say what men can do is the services available. But as the good representative from PAHO had shared, sometimes the coping measures turn to be alcohol and other destructive means of coping, which are not conducive for positive behavior. The question then is asked, why are men afraid to report violence? As the representative from PAHO had indicated, We are socialized in a community where it is not macho or cool for a man to go and report and say, this is what is happening to me by my partner, my wife, my girlfriend, my fiance. I know of cases where the perpetrator, or the victim or the survivor, as we call them, went to the police station to make a report and they were laughed at. And this was a male making a report. They were laughed at because, like, you can't control your woman. That's kind of a statement. And so it is the whole perception of our socialization that has made it difficult. So, in other words, the environment is not conducive for a man to step forward. So we need to start with the way we raise our boys and our girls, the way we condition them to see violence, and be it violence in the home or be it violence outside the home. And to also realize that everyone has emotions and everyone do get hurt and everyone needs to talk about it. And that men do not need to be quiet or suffer because it is not macho enough to talk about being abused by a woman.
Can I
don't know if, sure, go ahead.
Thank you.
Pastor Brathwaite.
This is Pastor Brathwaite, yes. Good evening. I just want to, first of all, just take the opportunity quickly to commend the organizers, Dr. Semper and her team, and also the presenters. Mrs. Morgan, Inspector Morgan hasn't been able to speak as yet. It would be really nice to hear some of the statistics. I wanted to sort of lean on something that Mrs. Wong spoke of, and just to broaden it a little bit in relationship to the frustrations that I am aware that many men face when they are dealing with issues of violence perpetrated to them. So many men would indicate certain frustrations, even with respect to the system and how, as you indicated, Nana, men are laughed at. It is socially almost unacceptable for a man to go and report and suggest that he's been abused. We have a little, we call it meme now, but there was a gentleman who was being abused by his wife. He was in his house, and his friends came over and met him under the table, and they said, I thought you were the man of the house. He said, yes, I am the man of my house, and I'm the man of the house, the kitchen, and I'm the man of the table too. So I can go under it if I want to, right? But he was being abused, and obviously found difficulty in being able to express his concerns. I want to just highlight, probably this would be a controversial one, but in relationship to husbands who, and I've, persons have come to my office and sat sometimes in tears, just speaking about the concern that they have with relation to sexual relationships, where it is suggested, a man would suggest to me, Pastor, it says, though my wife uses sex as a weapon, if I misbehave, I cannot be satisfied, if you want to put it that way. And that has been my experience for 2, 3, 5, 7, 8, 10 years. And there's a certain frustration that is exposed there that leads, and not to suggest in any way, shape, or form that, the way that a man may retaliate or respond may in any way be right if there is violence involved. Of course not. But just to suggest the frustrations that many men have, and have almost no outlet to speak to these issues. I just wanted to raise those and hope that it will engender some discussion. Thank you.
Thank you so much, Pastor Brathwaite, for that comment. And I believe what needs to be done is conversations like these need to happen, where we create an avenue for men to realize that it is okay to come forward, and we start unlearning some of those behaviors and some of the ways in which we've been socialized not to speak up. And this is where the men's departments of the church also can come in and act as a supportive role to the men who have issues that they need to talk about. But it has to be, as the representative from PAHO said, this cannot happen in isolation of one sex. In other words, men and women need to work together to foster good relationships. And good relationships come with first communication. And if one sex is communicating about their issues and the other is only under the table or not talking and not speaking loud about it, it can create a problem. I see a question here about the statistics in terms of men reporting abuse. I believe yes. I don't know what the data is for Antigua and Barbuda. I will ask the representative from PAHO if she has any data on that. And then the next one is how can women better support men so that they can improve their mental health? I would leave that for the representative from PAHO as well to speak to that.
So the statistics is very tricky because it's responding to what we've been saying. If you look at, I don't have the figure for Antigua and Barbuda in general, but I know it's low. It's extremely low. But that does not mean that the cases are low. But it is low because of what we've been saying. It's very unlikely that a man would go and report a case of domestic violence. So the fact that the statistics is low does not mean that the cases are necessarily low. You know, as women learn to empower their rights and things, sometimes this could actually result in some sort of them feeling abused because women are actually imposing their rights. And it could be as well that they are actually abused. So it's very tricky, and I don't think the statistics would show anything high. In terms of what can women do to support mental health, I think what Nana was saying, you know, it's a communication thing. It's a thing that, you know, woman could encourage. If you see that your husband is leading towards violence attitude, you can recommend him to visit a health facility to get counseling, to get psychosocial support. If you see it's strongly related to alcoholism, you could suggest, you know, why not visit a association that deals with alcoholism. But we do know also that many times when women suggest these things, it actually triggers a more violent situation for her. So it just depends, because we know that you know, women could easily identify that you're having a struggle and could say, look, I know about this organization that may be able to help you. I can make the appointment. But because of the help seeking behavior and that seen as weakness, men will still not go. So it's really challenging, and it has to do with as we were saying, it's a joint effort. It's a joint effort, and it's changing this paradigm. And it starts, as Nana was saying, with how we're rearing our kids now, because this has to move from a generation thing to let them realize that they have right to cry, they have right to suffer, they have right to feel pain. They are humans, and that strong imposition of them being powerful and non-feeling, you know, it's not true, and we should not insist on putting this additional pressure on men, because this pressure is what sometimes is exploded in a violent situation.
Thank you so much. I see the hand of Beverly James. After Beverly James, when you pose your question, we'll take the next question from Valerie Williams and answer both questions at the same time. And I don't know who is monitoring the YouTube or the, I think we're live somewhere else. I'm not sure. Let me see. If there are any questions from those links as well, please share them. Yes.
Good evening.
James. Yeah.
Good evening. I wanted to find out what are the groups, whether Women Against Rape or any of the other groups within Antigua and Barbuda, are doing to assist persons who are in impoverished areas in Antigua and Barbuda in terms of gender violence. Because you have an area, let's say that we talk about the village rearing the child, but what about those persons who are in areas of that nature who are impoverished and therefore might be afraid to speak out? Because we are speaking about violence against or gender-based violence. We spoke about the men, and sometimes I think it is a situation whereby, and men and women, low self-esteem has caused us not to be able to speak out. But I wanted to find out about Women Against Rape and the other groups. What are they doing, or have they been doing anything to help those persons on the privileged areas, especially in Antigua and Barbuda, to gender-based violence?
Thank you so much, Ms. James. We'll take Valerie Williams, and then I would invite Nurse Wong to respond to your question based on the services on the ground, and another representative based on the question that Ms. Williams will pose.
Thank you, Nana. Dr. Omer actually said part of what I was about to say, in that what is happening is that our reporting is very low. And some of this comes from the fact that because gender-based violence is still something that is taboo in our society, you have even the healthcare providers who actually, and the police, to whom these persons go as first-line responders to deal with gender-based violence, where, you know, they've been laughed at, and, you know, it's like that becomes a talking point of the day or the shift. And so persons are afraid to go and tell their story, unfortunately, to a healthcare provider or a police officer, who are the persons that are entrusted to help with these issues. And so people just decide to, you know what, just let me stay home, deal with my stuff myself, and then that gets transferred into another compartment of their life. And so the abuse and everything just continues, because then when you can't take it out on the mother, you end up with the kick the dog syndrome. So you get upset, you beat the mother beat the child beat the dog beat the cat. And so what really needs to happen is that we really need to relook as a society, and because we're doing this from a church perspective, because these things do happen within our church situation as well. And even within the church, sometimes, unfortunately, persons are telling you that they've just been told to go and pray about it. But prayer alone is not going to work for this. So we have to have some action. And so what we need to do is to build capacity. And I know within the health system, we have been training some of our healthcare workers to actually address gender-based violence. So we have to look at the entry points of the healthcare system where these issues are brought in, and make sure that our healthcare providers are alert and aware and equipped with the necessary tools to deal with these situations. Thank you.
Nurse Wong, would you like to respond to Ms. James's question?
Yes, Nana, thank you very much. And Ms. James, thank you very much for asking that question. In my presentation, I spoke about networking. For the years that we have been in existence, we have established networks in all of the parishes, including Barbuda. We have trained the persons as advocates, and we train them in the response system. The response system is based on which entry point is available, especially if there is a threat or a danger to life. So what our advocates in the community have been doing, and I must say that St. George's and Grace Farm are our strongest community networking support, because they call us pretty often to clarify situations and or to come and do events in their communities. In addition to that, with the domestic violence training, a number of policemen were trained. Their task was to, when they go back to their stations in their village, to create a space where we can go and talk to their communities about gender-based violence and build up the capacity of community groups, so they will know how to report, they will know what violence looks like, they will be able to identify the different types of violence. And in cases where they're not sure, they can call us because our helpline is a 24/7 helpline. In addition to that, we have received other funding sources where we have done skills-based training for young women who have been identified as vulnerable women and girls. So yes, we have been working, we continue to work, and any other form of assistance that we get, we will gladly welcome. I must say also that one of our legal advisors, accompanied by myself, have gone to the Sir Wright George Academy over the last couple of weeks, and we have had refresher courses with both rank and file and some senior officers in reviewing what is the role of the police in the Domestic Violence Act. So we continue to work. I do acknowledge that there's always much more to do. So we welcome on board any suggestions and any skill set that will help to improve the quality of what we do. Thank you.
Thank you so much, Nurse Wong. I see a comment in there in the chats which is calling for fundraising to house and properly assist with abusive persons. They're not sure if counseling is the only way. And I think Nurse Wong had in her presentation indicated that a shelter was not available in Antigua and Barbuda. So if this is something, I believe the South Leeward Conference and probably in the other territories, I don't know what exists, and I believe St. Kitts and Nevis is also on the call. But this is something that the church can take upon to move the situation a little further in terms of providing a shelter for persons who are abused. I have another question which I'm seeing here from a participant. How do women abuse men? I think we answered that question, which was verbally, and also, as Pastor Brathwaite has shared, some of them withhold sex from their partners. And also, in some cases, it is physical as well. Dr. Omer, you wanted to say something?
No, it's regarding the services.
Sure, go ahead.
And one of the questions was saying, how do we reach to the vulnerable populations in terms of distance, in terms of rurality, in terms of sometimes ethnicity and sometimes even education. And many times that's precisely the challenge. We have limited services, and as usual, the persons that might benefit are the ones that has more access to it in terms of geographical distribution. And then sometimes the services are so complicated that women fall through. Because as I was saying, for a woman or a victim to make a decision to actually denounce that they're being victim of an abusive situation, it's a long process. And as Valerie was saying, the Ministry of Health could provide counseling support for months, years before a woman could actually decide to take that decision. It's not just a one-day thing, I'm going to do it tomorrow. And it takes a lot of building, empowering women before that decision is decided to be made. So having those services it's a long-term process, but it's an ongoing process. But also once that service is that first step is made, there are 4 key essential services that women that are, or men that are being victim of violence require, which is the legal support, the police support, the health, and the social. And sometimes we don't have the 4 of them at the same level. We have most of the response being in the social department, but the legal is not responding in the same level, or the health is not responding. And then the lady receives an unbiased support, which at the end results in her dropping out the system. You know, because, okay, you gave me the counsel, I decide to go to legal, and then I find all these blockages in the legal service, and then I don't get that support either. So the essential package sometimes are at different levels. They're not at the same level in terms of responding. And I agree, a shelter sometimes is an important service that social should be offering, because there are times that women have to move immediately out that violent situation. And if you don't have an option to offer, then we need to explore options of increasing these services.
Thank you so much for that intervention. Ladies and gentlemen, that brings us to a close with our question and answer session. I want to thank all the persons who posed questions and made comments. I personally do not like to be involved in things that just happen to be a talk shop. So I would charge the organizers that let's not make this event just a talk shop. We have spoken about practical interventions that can assist persons in Antigua and Barbuda. I believe the ministry, together with the church and PAHO, can work on a campaign that will encourage men to speak about their abusive situations, because the topic for discussion is men's health, COVID-19, and gender-based violence. So a campaign to encourage more men to speak out about the issue, to also deal with the root causes of socializing men and women to feel that it's okay to talk about these things, and how we have to unlearn some of the behavior, the gender norms that we've been taught that are very destructive to our health. And so on this note, I would also commend and ask the South Leeward Conference to encourage its pastors to also send the message out, because most often when it comes to abuse, a lot of persons just use the Bible and say, well, man was created to lord over woman, and then that becomes a very disruptive space. To encourage the pastors to share the message that creation did not start off like that, as man lording over woman, and that equality is what God envisioned. And so that is what we as Christians should try to emulate as well. So I want to thank our presenters again, and thank the organizers for having me be part of this session with the group. And I hand over now to, I think, Mr. Hewitt.
Thank you very much, Libby. You did a fine job in coordinating the open dialogue. And thank you very much. You're all the way in Trinidad, and you did a fine job. Thank you. Thank you. Thank you. I noticed we have Dr. Kati present with us. She was unable to do her presentation last night. Welcome, Dr. Kati. Okay, so this topic is not exhausted, and I do hope that we can continue to have more discussions on it. I now invite Dr. Semper. We are way over our allotted time, to give an expression of thanks. Dr. Semper, are you there?
Yes, I am here, sir, and I wish to just express thanks to everyone on behalf of the South Leeward Conference of Seventh-day Adventists. Indeed, the discussion has just started, and I am grateful for the recommendation that you have given Sister Hessin, that you specifically said you do not want this to be a talk shop. You would wish that the church would further embrace the concept and seek to maybe become, have shelters and continue the discussion in real and meaningful ways. I want to start with thanking you first. You were excellent in the way you coordinated tonight's program. Thank you. We really appreciate your support and your guidance. So may God continue to bless you. I must express thanks to Dr. Omer for just coordinating and ensuring that this happened tonight. Your leadership, you have brought this experience and your own experiences as you spoke. I realize you have a passion for what you do. And truly tonight, we're talking about men's health, but we cannot separate men's health from the women, because the women and the men and the children must work together in order to ensure that the men are healthy. So thank you for the perspective that you have taken. And the questions truly highlighted tonight's focus. How do we together, collectively, appreciate the men in our lives and help to make them better people? I trust that you will continue to be blessed, Dr. Omer, and that through your leadership and ministry that other persons will be blessed too. Thank you for the excellent work that you're doing. So on behalf of the South Leeward Conference, we all express thanks to you. And Miss Wong, you were short and to the point. I liked your presentation. Yes, you have a passion also for what you do. And I realized at the end, you pulled it together for us when you highlighted specifically how the men can be helped. And you spoke about the psychological support, and you spoke to women also. Thank you for just being a part of tonight's session. I am so sorry we missed you, Mrs. Morgan. We missed your presentation and what you had. But another opportunity will come, and probably you can record it and give it to us so that we can share with the churches. And the coordinator tonight was Mr. Hewitt. Thank you, sir, for doing an excellent job. We had some technical challenges, but such is the world of technology. I trust that you will continue to support wherever you are, and we wish you well at your workplace also. But to the panelists, you guided tonight's session. Thank all of you for coming. Thank you so much for being on the platform. Some of you on the YouTube, Facebook platform. Thank you so much. We continue tomorrow. And Dr. Carty is going to be an important part of the presentations tomorrow. We talk women's health. Tonight was a men's health. Tomorrow evening, we speak to women's health. And the St. Kitts Association, Health Association, they're responsible for tomorrow evening sessions. So see you all tomorrow evening at 7 p.m., where we shall continue to discuss the issue of women's health. So thank you, everybody, and may God continue to bless us as together we seek to make our nations, wherever we are, Antigua, Montserrat, St. Kitts, Nevis, Antigua and Barbuda, wherever we are, continue to make a difference in our space that God has given us. Be blessed.
Okay, thank you very much, Dr. Semper. You have done a fine job as well in organizing this webinar for the last night and tonight. So everyone, please join the conference tomorrow night in the next webinar. Goodbye and take care.